Dr. Hooman Melamed, MD, board certified orthopedic spine surgeon, talking to you about decompression, some of the terms that are out there: microdecompression, decompression, laminectomy, laminotomy. What are all these terms? The most important thing I've learned is that you want to just get to the root of the problem and preserve as much as normal anatomy as possible. And I can tell you most of the time, the problem is in specific areas. And if you just deal with that area, that is what I call the abnormal aging or abnormal process, you just eliminate that, the patients are going to do beautiful. The problem is that a lot of times, a lot of people, what I've seen, they do what's called laminectomy. So if you look from the back, this is the spinous process, the structures you feel in the middle of your spine, which you have it all the way from your neck down. This is where it goes down to the lamina. Behind it is the spinal canal and where the nerves are sitting. Laminectomy means you cut the bone here, and you remove the whole thing here. Now keep in mind, there are very, very super important ligaments connecting the two bone structures together all the way around basically. So it is so critical. These ligaments are very critical in your overall stability. These ligaments are not causing the problem. Usually the problem is inside in here where the problem is. So a lot of times if you just come in, what I call a laminotomy, you shave a little bit here, you remove the abnormal bone spurs in here, that's all you need. Preserve the rest of the ligaments and the bony structure. The more bony structure you leave in place, the better the stability, which means the ligaments are intact. Now, are there situations you have to do a complete, what we call laminectomy? Yes, you have a major cancer, major infection, severe compromise of the canal in all areas. Sometimes, yes, you have to do it, but I would tell you 95% of the time, patients do not need full laminectomies other than just a little simple decompression rotor-rooter. And a discectomy is when a disc is herniated basically. So a disc is herniating to the nerve, you make a little opening and you just shave down the disc that is putting pressure on the nerve. That's what's called a microdiscectomy. It's an outpatient procedure, doesn't take a long time, with straightforward recovery. Are there cases where the microdiscectomy could be complicated? Absolutely. The disc is herniated in all kinds of places and it requires a lot of work to decompress the nerve roots. It can cause a little bit more of a complex operation. So yes, how common is that? Not that common. Most of the time, a lot of these can be treated with a simple, what I call microlaminotomy, a little opening, rotor-rooter, just get in there, clean it up and get out. And the patients will do fine. They don't need huge, remove the entire bone, the ligaments, all that stuff done anywhere, especially in the neck or the lower back, because long-term, I don't think it's good to mess with God's anatomy if you don't have to.